Hey, check 1, 2. Hey. How to do? Check 1, 2. Check 1, 2.
Ladies and gentlemen, please take your seats. Our program will begin shortly. Good afternoon to everyone joining us today here in Easton's historic Avalon Theater. And also welcome to everyone watching this event on our YouTube live stream. This community town hall is titled Charting a Bold Course for Eastern Shore Healthcare. In a few moments, you'll hear all about the University of Maryland, Baltimore's vision for improving healthcare in our communities directly from UMB President Bruce Jarrell and the deans of the University of Maryland Schools of Medicine and Nursing. And later, you'll have a chance to ask your questions, whether you're here with us in Easton or watching online. But let me first introduce a very respected leader in the healthcare administration. As president and CEO of University of Maryland Shore Regional Health, Ken Kozel brings decades of experience in hospital operations and strategic planning. His commitment to advancing patient care and fostering community partnerships has made a lasting impact across the shore. So please join me in welcoming Ken Kozel.
Good afternoon, everyone. How are we this afternoon? All right, are we in for some fun? All right, well, first of all, thank you. Thank you so much for being here this afternoon. As was said, my name is Ken Kozel, and I'm the president of University of Maryland Shore Regional Health. And I have been blessed to be the servant leader for the University of Maryland Shore Regional Health for almost 15 years now. And I say that because it's important to know that for the past 15 years or so, we have been working very hard at Shore Regional Health at developing an integrated clinical delivery system on the shore. We're 5 counties, we're pretty spread out, but what we needed to do was get integrated. and create a system that allows for about 95% of the care that you get right in your own backyard. And for that high level of care, that inpatient care, our vision has been to build a regional medical center here in Easton. So with all of the puzzle pieces together in the other 4 counties, guess what? We are now starting to build a regional medical center here in Easton. How about that? I don't know if you've seen it on Route 50 as you pass the Talbot County Community Center, but we've got 2 of the largest cranes on the eastern shore. We've got footers laid, we've got columns starting to go up, and we've got a structure that's taking hold for our community. It is going to be a state-of-the-art facility for this region for decades to come, because our vision has always been to establish the best healthcare we can in rural mid-shore. And I share that with you because you might not know, but what's going on in rural healthcare across the rest of the country is incredibly challenging. Hospitals are closing, hundreds over the last 2 decades. Hospitals are cutting back on services in rural healthcare areas. And we said that's not going to happen on Maryland's Eastern Shore. We're going to create that integrated delivery system. We're going to build you a regional medical center. It's going to be a state-of-the-art facility that we can all be proud of. And I am so pleased to share that now that I'm going out in the community and sharing that we're realizing our vision, guess what the first question people ask me about is? Well, what are you going to do about workforce? It's great that we're going to have a great hospital, but what's the workforce going to be like? And that's why we're here today. We're here today because of another visionary from the University of Maryland, Baltimore, a visionary who lives in this community, born and raised in Caroline County, a visionary who went to University of Maryland, Baltimore back in 1997 and rose through the ranks to become president of the University of Maryland, Baltimore in 2020. And that's our friend and colleague, Dr. Bruce Jarrell. Dr. Jarrell is here to talk a little bit about the collaborations that we've been working on for healthcare providers in rural healthcare places like Shore. And I'm just so blessed and proud to have his collaborative spirit, to have his visionary mind, and to be with him today to help solve the second of the 2 major challenges that we're facing. One's facilities, the other one's workforce. So please give a huge round of applause to Dr. Bruce Jarrell from the University of Maryland, Baltimore, and our colleagues from the Shore.
Thank you, Ken. It's a great pleasure to be here, and I can't believe the turnout. This is spectacular. It wasn't all for me, so there must have been a better reason, right? So welcome. What I'd like to do is just give you a little bit of background about UMB, about our schools, and then what our vision is. But really, this is intended to be a conversation, a 2-way conversation. And you notice I had to move the chairs up closer because I want it to be like a fireside. I want us to have real dialogue and get to some of your questions. And yes, Ken, I saw those 2 cranes and I couldn't believe it. Okay, I couldn't believe that that's finally come true. So let me start off with just what is UMB, because there's a lot of confusion about that. UMB, University of Maryland, Baltimore, is a university that sits in the middle of Baltimore. And yes, we have Baltimore in our name, but we also have Maryland in our name. And we're very committed to this state as well as to the city. Now, I came there as a surgeon and practiced surgery for some time, and then moved up through the ranks. When I was in the medical school, which is where you do surgery usually, I don't know that I knew there were other schools at UMB. We were so focused. But yet, UMB has a school of medicine, yes, but premier programs, a school of nursing, which you'll hear from in a minute, a school of pharmacy, a school of dentistry. There's a school of social work, and we have a member of the Board of Visitors from social work here today. A school of law, and yes, it's a surgeon with a group of lawyers. It's trying at times, but I do manage. And then we have a graduate school, and we train quite a few PhD researchers to go out into the world and make new discoveries. So it's a very different place from where you have undergraduates. We have almost no undergraduates, but we have a very important 15% nursing, Dean Ogbolu, so I won't forget those. But we're largely a graduate and professional school, which means that we're focused on what we're there for, to learn about the practice of healthcare or law or social work. So it's a pretty intense place when it comes to that, and it's also very intense when it comes to research. And any of you who have had, and I hope none of you have had a serious illness here, but if you do and you got better, you just need to know that medicine, the practice of health care in general, is what helped you get better. And so we've come a long way in that, and I hope we come a long way further. And of course, as everybody gets a little older, it's nice to have really good health care. Now, of course, that's where we start here. Yes, I did grow up in Goldsboro. Some of you have heard of that place. It's got 3 stop signs and 2 railroad crossings. That's about it. But you know, I grew up on a farm, but it was a good place to grow up because you learned a lot of values. You learned the importance of people and working with people. You also learned about hard work and what it takes to get to where you want to go. So it was a great place for me to grow up, and I wish my children were there. They, of course, don't want to be there, but it was a great place for me to grow up. And so I left Maryland for some time in my training, and when I came back in '97, my mom was sitting there waiting for me, and of course it was, Bruce, what are you going to do about health care on the Eastern Shore? She says, my friends can't get access. They can't get what they consider to be the best care. They have to go across that, she didn't say it this way, but it was Darn Bridge. That's not quite what she said, but you have to go across the bridge and you've got to fix this. Well, of course, I was a surgeon in the OR. I didn't have any way to fix this. But she reminded me each time she saw me, and so I each time thought about it a little bit more. But it didn't happen until 2000, year 2000, when I got appointed to this position, that I finally said, you know, there is something I can do. Of course, COVID came along and foiled all those plans, but also appointed at that time was Dr. Mohan Sunta. Dr. Sunta is the CEO and president of the medical system. And maybe to parse a piece apart for you for just a second. So there's UMB, which is a university. It's a state entity. We are, I hate to say it, state employees. Okay. No, I don't hate to say it. It's a wonderful state in terms of practicing medicine and universities. And then there's the medical system, the University of Maryland Medical System, which is a hospital group of 12 hospitals. We used to be together. We're very separate from a legal point of view, but from a alignment, from a strategic plan, from a here's what we need to do to get the job done point of view, we're highly aligned. And so if Dr. Sunta were sitting here, he would say, yep, I got appointed in the year 2020. Both of us did, and both of us said we're going to address things here on the Eastern Shore. And I think we've been good to our word seeing those 2 cranes. But you might ask the question, well, what would I say back to my mom today? She's not with us anymore, but she was here till 101. And what she would want to hear from me is, well, what do you plan to do? And so we're going to talk about that a little bit now. I think what I would say back to her is something along the following lines. Well, Mom, first of all, it takes a good medical facility. It takes a community of physicians and nurses and nurse practitioners and pharmacists and dentists. I can't forget the dentists. It takes politicians. It takes business people. It takes people committed to the medical center, to its board, to this community. It takes foundations, and it takes people like all of you who say, wait a minute, we want to see change. So first of all, it takes a community who wants to see change, a community who realizes that there's a problem, and realizing that the solution is not going to be simple. How long did it take those cranes to get here, Ken? Over 20 years. 20 years. It took 20 years to get it. It's too long, but yet it's here. So one, it takes that kind of community. The second thing it takes is another part of the community, and that is, I'm going to use the word pipeline, but that simplifies the idea. The idea that a community believes that its children are smart enough, that the opportunities are good enough, that we can create the opportunities for those young men and women to go into a career and believe that they can be successful, whether it's healthcare or other things. But the point is they can be successful and that it could be available in their own backyard. So instead of having to go to Baltimore or out of the state, I went to medical school in Philadelphia. I had to go out of state. To have the idea that I could succeed when I'm in 9th grade to become a physician or a nurse or whatever. And so that takes the high schools, that takes the community colleges, that takes the universities of Maryland, for example, our partners. It takes a lot of people to get that to go. And then it takes people like you. If we're going to do things locally, it takes people like you to say, wait a minute, I want to make it so that these young people not only go into medicine or nursing or dentistry or pharmacy. I have to say all four together or I get in trouble. It also has to be that I'm going to be able to do some of my training here on the shore where I live. After all, I like this place. And it also means that I can't go in debt. My medical school or my dental school debt can't be the same as my family's farm mortgage, for example. Questions like that. And I've heard that many times from kids who say, I can't do this, it's too much debt. So your philanthropy, your generous gifts to this university are coming for a very specific point, and that is so that these young men and women can train here and want to stay here. And then third, it takes a lot of other people to make this happen. It takes a vision meaning I have an idea and I'm good enough and smart enough and have enough support around me to make a vision happen. So what you're going to hear from today are from 4 deans that we have to talk about what is the vision for healthcare education on the Eastern Shore and how do you get them to stay here? Because the idea isn't just to train them and have them leave, like I did, I'm sorry. The idea is to have them come here and stay and want to be part of the community and know that the community thinks a lot of them and appreciates their being here. And then one last thing, I think, and this is really important. I was a general surgeon in Dover, Delaware for 3 years. I loved it. I did a lot of nice cases, nice patients, nice everything, but I didn't have one nice thing, and it's called students. I didn't have a young man or a young woman who went around with me on rounds, who asked questions, who learned from me, oftentimes, I would hope, asked questions that I didn't know the answer to and that I would be better. So the idea of creating not just a rich medical community, but a rich medical community that trains the next generation, to me is a critical part of success here. So I'm thinking 5 or 10 years from now when some young man or woman comes back and says, you know, this program worked, here I am, and I'm now practicing in Cambridge or Easton or Salisbury or wherever, we'll know we got it right. And so part of what the purpose of this afternoon is to say, let's see if we can't get it right. Let's keep hearing about what's important to you. And let's make sure that we've got all of our I's dotted and our T's crossed. One last thing. We have a broad cross-section of people here, and I wrote them down. I may have to look at it to see if I can get them straight. But I'm really pleased we've got some elected officials here, both from the state legislature, a delegate or two, and maybe Senator Motz will show up a little later on. And also some representatives from the county elected government. Thank you for being here because this won't work without your participation. A second thing is we've got a lot of the healthcare community represented here. So I looked it up and we have MDs, RNs, we have DNPs, we have dentists, we have physician assistants, we have physical therapists. We have a wide range, and I know I left some, and we have a social worker, I can't leave that out. We have a wide range of practitioners here, and you're going to be critical to making this work in the medical community. We also have, I'm happy to say, representatives here from Tidal Health, because this isn't just about our 5 counties, it's about the whole shore. And so the more we can develop the whole shore, the better we will be. We also have Choptank Community Health Center people here. I know Sarah Rich couldn't make it, but those of you who came, thank you, because they're a really important partner here. University of Maryland Eastern Shore, there's someone from the physician assistant and the physical therapy program here. I don't know whether there's anyone from Salisbury University here, but they're all my partners, and of course they'll all be important to make this work. I probably left somebody out. Who did I leave out? Anybody want to tell me who I left out? You think I got them? Community colleges. Thank you. Chesapeake College is here, and I understand a couple of people, and again, a very important partner in this. And you remind me that there's, I know, representative from at least Queen Anne, Caroline Talbot, and Dorchester County school systems here. Again, really important kinds of things to have here. So with that, what I would like to stop my talking and introduce you to our 4 deans who are here. We can, 2 of them I'm going to have up here, medicine and nursing, whom I'll introduce in a minute. But again, the idea is to have a conversation. So let me begin to invite 2 up to the podium here. One is Dr. Yolanda Ogbolu, who is the Dean of the School of Nursing, and a wonderful colleague. You'll hear all about her school. The second is Dean Mark Gladwin, who is Dean of the School of Medicine, a serious scientist, but a person very committed to education. And I would say to you that both of these deans are driven to see programs here on the shore survive and thrive and produce the products that we've talked about. We also have here Dean Mark Reynolds. Stand up, Mark, so they can see you. Okay. And also Dean Arrett, who is here representing Dean Sarah Michelle from the School of Pharmacy. She could not be here. But what I'm going to do is ask each of the 4 deans to say a vision for how they see their profession developing programs here on the Eastern Shore along the lines of what we just discussed, and then ask Dean Reynolds and Dean Arrett to make a comment on each of their schools. So I got Dean Ogbolu first. Dean Ogbolu, what's your vision for the Eastern Shore here?
Good afternoon, everyone. Such a delight to be here. I've been here for about a day and a half and just enjoying meeting everybody in Easton and the vibrancy from the Waterfowl Festival yesterday, as well as a visit to Chesapeake College today. When I think about why we're here today, I really think about the nursing workforce shortage that we know is already here and is projected to worsen by 2035. All of us want to go to the hospital, but we also want to know that we're going to see a well-qualified nurse there that's able to take care of us. And we have a lot of really great partners here on the shore, nursing schools that are really doing a great job. But when you look at nursing workforce data, what you find is that by 2035, the shore will only be able to meet 66% of the nursing need for the shore. And that's what's really driving us. How can we be a part of something larger to really improve the healthcare workforce and to ensure that we have enough nurses for the future? Our School of Nursing is 135 years old. We have been working on the shore indirectly for many years, and I can give you an example of how we see those outcomes. We have 500 nursing alum currently living in the shore right now that are already here on the shore. We have 45 students that live in the Eastern Shore that are currently enrolled in our nursing school at University of Maryland, and we've received 56 applications from the shore for the past year. And so there's a demand of students that want to receive a bachelor's degree, and our school is well equipped to do that. We want to have a program where it is a satellite at the shore. We don't want students to have to get on the bridge and come to Baltimore. We want to be able to offer our students the opportunity to be educated right here on the shore. And we find that that's really incredibly important in terms of building a pipeline that is likely to stay on the shore. Developing a satellite is not something that's new to us. We've done that before for Frederick County and for Montgomery County at the universities of Shady Grove. We started with 20 students, and now we have 500 students. It took 24 years, so it's not something that's going to happen immediately, but we want to start small with a satellite, a registered nurse program where students would receive a bachelor's degree, and at the same time offer students opportunities that are already here, graduating from great places like Chesapeake College, an opportunity to come and do an RN to BSN program. We also offer master's and doctoral degrees, but that's not where we're planning to start. So that's a little bit of my vision, and I'm really excited after being on the shore for the day and a half of just the wonderful people we've met and the opportunity for the future.
Thank you, Yolanda. Dean Gladwin.
So maybe just really quickly, how many of you have had challenges finding a primary care doctor or a specialist doctor here on the shore? Put up there. So a lot of hands are raised. So the Eastern Shore has been designated an area where there's going to be there are currently and there will be increasingly severe health professional shortages. So it's a declared health profession shortage area. In addition to that, when we look nationally, our population is aging. And as we age, we keep accumulating problems that we need to see health professionals for. But as our doctors age, unfortunately, they retire and become patients. So there's two lines that are crossing that aren't good. And in fact, I was just at the Council of Deans meeting at the American Association of Academic Medical Centers, and they did brand new modeling, even accounting for the fact that half of your visits where you'll see a health professional today are with advanced practice providers instead of a physician, typically a nurse practitioner, and we have great training programs for nurse practitioners and physician's assistants. But just even with the maximal growth of advanced practice providers working at the top of their medical licenses, we're still expecting to have a 200,000 primary care physician shortage and a 200,000 specialist shortage by 2040. And so we feel that we have a moral imperative to grow our class size and to think about, as we grow that class size, how do we create programs that encourage people to work in rural areas like the Eastern Shore of Maryland. And the thing about access to health care on the shore of Maryland, it doesn't matter whether you're the wealthiest of the wealthy, the poorest of the poor, access is hard for all of us. And so this is a problem. As we've traveled around the shore, we're really delighted about this beautiful hospital, but we also need nurses, doctors, dentists. We need providers here. So I'll mention more about the program in a minute maybe, but we're creating this new program. We've actually got approval from our licensure organization. In fact, we heard the formal approval 2 days ago to expand our medical school from 150 in year one. Now remember, medical school is 4 years. So we have 150 in year one, 300 in year two, and it goes up. So we've got approval to go to 200 students. So 200, 400, 600, 800. And part of that expansion is we want to address need. So we've created a special track that we're calling Rural MD for medical doctor in Maryland. And that track, we have 10 students per year. So again, 10, 20, 30, 40. There'll be 40 students that our goal is to have full scholarships. And that scholarship requires loan repayment for service on the Eastern Shore of Maryland. So every year of scholarship is a year of loan repayment, and that could be working at Tidal Health, that could be working at Shore Health, that could be working for our partners in Chop Tank, that could be working for many of the physicians in the room who like Letty, is looking to hand off his practice at some point to that next brilliant young physician. So we're really excited about this program, and here's the most exciting thing. We are preferentially looking at people that come from rural areas like President Jarrell, or people from the Eastern Shore. And in our first year, last year, we had 200 applicants, and 7 of our accepted students are from the Eastern Shore of Maryland. And this year, and this year we've had 400 applicants for these 10 slots. It looks like almost everybody is going to be from the shore, and they have to go through all the same competitive process. It's less than a 5% accept rate, as you can imagine, and dropping. But these students are meeting those qualifications, and I think just knowing that this program exists is making this seem like the art of the possible for the best students from the shore. So we're really excited. I don't know if we have any of our students here today, but if we do, we'll introduce them to you later. But I'll stop there and tell you more about the program later if you have questions.
Thank you. Dean Reynolds, School of Dentistry.
Thank you. Good afternoon. I'm delighted to be here. The Eastern Shore, like Western Maryland and areas within the city, is designated a dental health professionals shortage area. Throughout Maryland, there are about 70 dentists per 100,000 residents. On the Eastern Shore, about 90% of the Eastern Shore, it's less than 20 dental providers per resident. Consequently, we see very large numbers of residents that turn to the hospital emergency departments to receive care. In fiscal year 2019-20, that number was about 35,000 patient visits, which speaks to barriers to access and the importance of developing workforce on the shore. So we are envisioning a clinic that would allow us to not only bring trainees from other parts of the state and nation to see the shore and to learn and provide care to help reduce the demand on emergency departments, but also to enable those from the Eastern Shore to be able to train locally. And so from our perspective, that's an important aspect of this. Of course, there's other elements I'd be happy to share with you, but I'll stop there. Thank you.
Shady Grove.
Thank you.
Mention Shady Grove, please.
So, and at the University of Shady Grove, we have a 24-chair clinic. The clinic is vibrant. We opened in November of 2019. We had to close shortly because of the pandemic. But we train our dental students, our dental hygiene students. We now have residents rotating, and we would actually also look to have residents on the Eastern Shore and the different specialties to ensure that we can provide a full scope of practice. Last count, we saw approximately 4,000 residents in the past year.
Grove is near Rockville.
Yes.
And we have a part of the university system that's at Shady Grove. And nursing has the biggest program at Shady Grove. So this is separate from Baltimore. And dentistry has now 27 chairs?
24 chairs.
24
yes.
chairs. And it goes to show you, if you plan it right and you get the right kind of facilities, suddenly training happens, suddenly service to the community happens, suddenly people say, I could live here and work here. So that's a good example of something very successful. Dr. Arrett, you want to talk about the School of Pharmacy?
I do. I'm very excited. Thank you for having me today. Both of you gentlemen brought up very key issues, access to care. And we all know that pharmacists are our most accessible healthcare providers. It's easy to walk in anywhere, whether that be your grocery store, your local Target, and get to the pharmacist. So our vision in the School of Pharmacy is really three-pronged. One, increase access to care. Does that mean beyond your vaccines and your medications, now you're going to a pharmacy and they're helping you choose medications. They're testing you for COVID, doing your flu vaccines, all kinds of things. We're being innovative in the types of medications that we're researching in the school. Is it a new nanoparticle that can deliver this medication via a patch or a cream, so you don't have to remember to take your medication daily. We're also working as pharmapreneurs and trying to innovate the way we deliver medication and healthcare to the state of Maryland. So maybe we're delivering your medication via a drone, maybe it's coming via Amazon, but really increasing our partnership with the School of Pharmacy that's already here on the Eastern Shore to make sure that we're all working collaboratively to continue to be that most accessible point of healthcare for the state of Maryland.
Do you know? I think most of you know there's also a school, a pharmacy at the University of Maryland Eastern Shore, and they're our partners too. So maybe what I do is just ask one or two questions of the panelists, but then I want to really open this up to questions because I think that's where we can have the most impact. So with that, I want to start with Dean Gladwin, and that is, Mark, what's made all this possible? How were you able to get all this interest, 400 students for 10 slots and growing, in a class? Remember, we have 7,000 applicants for 150 slots in the medical school. So this is a phenomenal kind of demand. Why is that happening?
So I think one thing is, young people look at what's possible. So if you know somebody that became a basketball player or a professional athlete, you think, I want to do that, I can be that. And I think for many young people, especially on the Eastern Shore, growing up in the Eastern Shore, growing up in rural areas, maybe they didn't think it was possible to get into the University of Maryland. In fact, we heard that, the students don't get in when they apply from the Eastern Shore. And so by creating this program, that our goal is to attract the best and brightest kids, I'll say kids, but these are definitely young adults, that they want to come to Maryland, it's possible. And so what we do, and we do this, by the way, for everyone in the state of Maryland, we're a public university, and 70 to 80% of our class comes from Maryland. 55% stay in Maryland for their residency, and probably a larger number ultimately come back. So we're very successful focusing on Maryland. And part of the way we do that is it's equally competitive, but we review the applications first from people from in-state. So that gives an advantage to those brilliant students coming from College Park or coming from the Shore. So what we found is there's been tremendous interest from the Shore. Now what we're hoping is going to happen is these young people will become role models to their high schools, to their peers. So one young guy named Nathan, I don't think Nathan's here, but is Nathan here? But this guy is locally famous. He's from Kent County, and everywhere I go, they said, oh, Nathan's in your program. And so I'm expecting now he'll, by his local fame, he actually went to UCLA, which, is so hard to get in that school, so from Kent County to UCLA, and now he's coming back to the University of Maryland, and he'll serve here. So that's one thing. The other thing is we've had a tremendous amount of support from all of you. There's many people in this room that are donating their time, and they're donating philanthropic gifts to support these students. Because again, our goal has been, we want the people that are really committed to rural health wanting to pick this program. And by offering full scholarships, that gets everyone's attention. And so far, we've had 3 full classes with full scholarships. And we're now looking for people that might want to endow a scholarship. For only $1.2 million, you can have a scholarship that would be named for the end of time. University of Maryland's been here for 200 years. We're expecting another 500 years. But that scholarship would allow there always to be a student, because essentially 1.2 million would generate the tuition, 42,000 for 4 years, every year for that student. But for a lot of people are coming together as teams to donate 200,000 where they can endow a full student scholarship. But those scholarships are making these students who maybe don't have the resources that people may have in other areas, and they're worried about loan repayment, especially if they go into family medicine or pediatrics or primary care. So these students seem to really be excited about this opportunity. So I think that's the second piece. The last thing I'll just say is people are committing their time. So we have physicians that are embracing the students working in their practices. We have every single public health, is it the commissioner? The health director of every county is now mentoring our students, and before they come into med school, they're actually coming for a program here on the shore, and then in the summers, they're rotating with the public health departments. We have partnerships with Chop Tank, who are very excited about taking our students. He mentioned someone from Tidal Health. They're very excited about taking our students. And of course, Shore Health is engaging and taking our students so that those students can be learners and work here in the hospitals. So I think those issues, people giving their time. We're also looking for people to house these students, because in the third and fourth year, they spend 3 months of the year here. We want them to get all excited about wanting to be here and stay here. And we've had lots of people volunteering their homes or creating programs of housing for these students.
I think Delegate Hutchinson was going to be here, and one of the things you should say to him, thank you for being here. You all want to thank him, and you want to thank him because the legislature has, over the past several years, increased the amount of funding for what's called the Loan Assistance Repayment Program, LARP, we call it affectionately, that makes money available for young men and women who are doctors, nurses, PAs, et cetera, to move into an underserved area and get a portion of their debt repaid. It's a wonderful program. When I first started here, and I'm not taking credit for this, it was about $400,000 a year. I believe it's over $4 million a year now, the state of Maryland. So that's a tremendous step forward, and thank you for that. Okay? Yeah. Mark?
I should have mentioned, and I want to just again sing your praises, the Eastern Shore delegation also put significant resources into this rural MD program, about $1.4 million a year, to cover overhead to expand this program to the University of Maryland Eastern Shore and to support all these students rotating here, so that when people give gifts now, it's really just covering the scholarship. And that support from the state also covers about 4 full scholarships a year. So the Shore delegation has been incredibly supportive of this, and we appreciate that.
Great. So, Dean Ogbolu, how would it work if you have a satellite here on the shore? And we're working on funding for that. How would it work for a young man or a young woman? How would they engage, and how would their week be? How much would be in Baltimore? How much would be over here? How's that work?
Sure. When I think about a satellite program for the shore, similar to what we have at the universities of Shady Grove, I see the program being implemented fully on the Eastern Shore. And so I'm hoping that students don't have to go back and forth over the bridge. We're really fortunate to have developed a strong relationship with Shore Health. And we've been working closely with them to think about what the clinical placement model would look like. And we're imagining a cohort model where students would complete their clinical rotations predominantly at Shore Health, but certainly likely at some other facilities as well, where they would rotate through the various units at Shore Health, and they would be able to really have experiences in each of the units so that by the time they graduate, they would have found a unit that they would love to work at long term. In terms of physical infrastructure for the didactic portion of the program, we're still very much in the exploratory phase with that. We've had some great meetings with Chesapeake College today and the Regional Higher Education Center, but we're still working on that. And we still have a ways to go to define where we want to go with that. Our School of Nursing currently has 2,011 students in the program, 500 at Shady Grove. We hope to start here with 20 to 30 students here on the Eastern Shore and then grow. And we're really excited about the potential to partner with a variety of people, with the community colleges. We already have articulation agreements where students from the community college, after they finish, can be automatically admitted and bring their credits to the University of Maryland. And so we're excited about the opportunities to build the bridge between community college, but also with other partners that we hope to meet with that might be interested in partnering with us. University of Maryland Eastern Shore has a pre-nursing program. So we anticipate that there are other students that really want to be nurses. And we also want to reach out to the high school students. I understand some might be up there. And if you are, I want you to know you can be a nurse. We know that people are here, they're bright, they're talented, and they're able to become a nurse. And one thing about the nursing profession is that we're really excited because it's the difference for a family moving into the middle class. And so it's a very, it would be a 2-year program, and we would be really excited to welcome people from high school, from community colleges, as well as thinking about nurses on the shore that need advanced bachelor's degrees, master's degrees, and doctorate degrees, which we could all offer over time.
So if they had a degree, an advanced degree, they'd be able to keep working and come to nursing school in Easton, if you get to that point.
Sure. We know that by the time you finish from an associate degree program, you're already working. What we're hearing from stakeholders here on the shore, from our alumni, is that students really want to be able to still work and then come to school in the evening. We offer the bachelor's, the RN to BSN program online. We're also hearing they want us to come. They want a cohort model. They want us to be here on the shore and help them navigate through the program. And so we're excited about the opportunity of being here. And we know that what we've seen is sometimes students do come to our Baltimore campus and they don't return to the shore. So how can we increase the likelihood that we're meeting our vision and our goal, which is to really increase the healthcare workforce on the shore? We think the best way is to have the program here on the shore.
And to actually make that become a reality over time, I got the pleasure of signing a bequest with someone sitting in the back there. Lawrence, stand up so people can see you. I think I can see you. Lawrence Heyman, a bequest to actually,
thank you,
of $6 million to help us establish this program. That'll happen over time. But the point is commitment. The point is we're committed to making this happen. And so are you, which thank you for that, Lawrence. 2,000 students sounds like an awful big nursing school, is it?
We're one of the largest nursing schools in the country, a top-ranked nursing school, and it's the diversity of the program. We have about 800 students in our bachelor's program, another 800 in our doctorate of nursing practice program, and we still have master's programs, certificate programs, and so yeah, we're big, but we're really excited. We know how to be big. We also know how to do it well in a small environment, as you've seen from my information sharing about starting at Shady Grove with only 24 students.
And maybe one of the things to appreciate is how much time it takes community practicing nurses to help train Dean Ogbolu's nurses. So when the nurses are rotating in the medical center, they have to be with a very seasoned Bachelor of Science RN kind of person, right?
Absolutely. And speaking to particularly the community colleges, they see the benefit of us being here because they struggle to find preceptors. Their preceptors have to have a bachelor's degree. And the number of nurses on the shore with a bachelor's degree is low. And so often they struggle or they rotate unit to unit within the hospital looking for a bachelor's degree prepared nurse. And that's something that we can really help, particularly with the support of our alumni. I mentioned we have 500 alumni, including Senator Retired Eckert, who's here on the shore. And we're always really excited to reach out to our alum for support in terms of helping us to meet some of the needs on the shore for bachelor's prepared nurses for preceptors.
What it used to be, eight or 10 student nurses per preceptor, and today it's 4 or 5?
Yeah, it depends on the model. You know, it's generally, for the most part, about 6, but sometimes we have groups as small as 3. And sometimes that can be good. It depends on the size of the institution. We went to Chestertown today, and Chestertown is a place where in the emergency room, probably 2 or 3 would be a good amount. I also want to shout out to Samantha Hoffman, who's a pediatric nurse practitioner who teaches at our school, but actually works here at Chop Tank as a pediatric nurse practitioner. So.
One of the things that struck me about the medical school program, the Rural MD program that Dean Gladwin talked about, was they have a summer orientation. They also have a network of primary care physicians. And maybe, Mark, you have a guest here, Dr. Norm Retner, maybe you could talk about that orientation and sort of what this network of physicians is about.
Thank you. And these, by the way, are 3 of the Rural MD scholars that have been accepted in the first year behind us there. So I don't know, Dr. Retner, do you want to jump up and tackle that question? So he's one of our deans of our curriculum. So he actually designs the curriculum. So he's the real expert. So.
Hello, I wasn't expecting to be speaking today, but I'm happy to be here.
Delegation.
So I'm actually one of the, I guess, the overhead that gets paid for from the state to help run this program. So the PMP program, or a pre-matriculation program, is a 2-week program that's in partnership with the University of Maryland Eastern Shore, where the students actually do a portion of their certificate program in rural health at UMES. So they have coursework in the morning, and then in the afternoon we have them rotating with our primary care physicians, the directors of health in the different counties. So they're both getting classroom experience as well as clinical experience out on the shore. In addition to that, we also do fun activities. We've taken them to Assateague. They went out to Smith Island. We have dinners together so that they form a cohort of students, of community before they get to Baltimore. And so that's a quick rundown of the program. And it was our first year this year. We have really good data for it, and we're looking to expand it and improve it for the next year.
But you have a network of primary care physicians in the area. Could you talk about that a little bit?
Yeah, absolutely. So we were able to form a group of core physicians, which includes some of the health directors, but also a number of primary care physicians. And that was also from the Maryland Rural Health Fund that was able to give us this grant, so that we brought on faculty members. They are now faculty members. We brought them on as faculty members to help mentor our students through the first 2 years, and then hopefully on to the 3rd and 4th year as they do their clinical rotations in like internal medicine or family medicine during their 3rd and 4th year.
Right. And we've met a lot of the physicians on the shore that all say the same thing, that they need to recruit partners, or they might want a succession plan. You know, they built this practice, you know, blood, sweat, and tears over these years, and they take care of so many patients on the shore, and it's breaking their hearts that if they retire, they might not be able to take care of these patients. So they're very excited, one, about the stimulation of having a bright student that's committed to rural health care and the ability to train somebody for their practice, but also maybe recruit somebody into their growing practice.
We hear that a lot from those who are interested in being core physicians, like we're looking for the next group of physicians to take over for us when we're ready to retire.
Yeah,
for sure.
We got to get them.
Thank you, Norm.
Yeah.
Thank you. So Mary's giving me the hook sign, which means it's time for you all to ask questions and have our experts answer them. So I have a question over here already. There's a mic.
Right here.
You have to walk.
Yeah, you have to come up.
Well, first and foremost, thank you very much to each and every one of you, Ken Kozel, Delegate Hutchinson, and everybody else who's making this vision a reality. Thank you very much. Secondly, my name is Reza Jafari. I'm the chairman of the Board of Trustees at Chesapeake College. We were delighted to welcome you today to Chesapeake College. It's, again, we're a member of the ecosystem and the partners that you put in there. It's a great opportunity for us to participate and become a partner in creating something that 15 years ago, when I first met Ken Kozel, he told me about this vision. And I was one of those first guys who said, what about workforce? So here we are now. I have two questions. One is regarding how we can expedite this process and what other resources you need from the community to help make sure this becomes a reality. And you indicated about the Center for Higher Education that happened to be probably ready and willing to participate in this. Secondly is, in the rural health, the biggest thing that we are all facing besides access is the fact that we do not have much of a knowledge about health, because we're still looking at the hospital as a sick center, not the health center. Is there anything that we can do on that side to prevent and do the early detection as we prepare ourselves for the next generation of our people, community members to come in? Thank you.
Sure. Yeah, I'll start by answering the question about what we need to expedite. We've done some financial modeling around the program, and we know from an operations perspective, we anticipate it'll cost about $2 million a year for operations. So we have received some donor funds, but we have a long way to go to really achieve the goal. In terms of having scholarships for 20 students, we would need about $1 million a year for scholarships for 20 students. That's $1 million total for scholarships for students. One of the things that we see in nursing that might be different from medicine is students need a lot of attention paid to what we call the social determinants of learning. Many students are working the same way I worked. I'm a community college graduate that later went on to get my bachelor's, master's, and PhD, but I know that students are working. Sometimes they're actually going hungry. Sometimes they're suffering with housing instability. We call those things the social determinants of learning. And so we realize that there are some students that might choose nursing that might need some additional support to meet their social needs. And so there's really an opportunity for many people to donate in many ways towards emergency funds, to stipends, to putting in support students. Because students have the talent, they have the ability, but they need a champion to really make this program happen.
When I introduced Dean Ogbolu, there's one thing I didn't say, and that is that she is the Conway Dean of the School of Medicine, the Bill and Joanne Conway Dean. Bill and Joanne Conway gave, I think, numbers 34 million maybe now, $34 million for student scholarships to give students a full scholarship support at the University of Maryland School of Medicine. It's a tremendous gift. And of course, it's just made things really stronger, and it's allowed these individual nursing students who need a little extra help to get through. $2 million a year to change direction. $2 million a year of infrastructure may sound like a lot to you. What I would say is the worst thing we could do is start a school over here and not provide the support that these students need to be successful. So it requires some duplication, sometimes a lot of duplication of what we have on the Western Shore in order to make sure that our students make the grade and graduate and get back to work. So sounds like a lot of money, but it's absolutely critical if we're going to turn out a high quality product. Dean Gladwin, you want to comment on this? Or?
Sure, great question. I think, so what we've decided to do, because it's the fastest and the most sort of cost effective, is to leverage the school that we have and increase the class size by 25% and then create this programming to direct students here. And allopathic medical schools, which are medical schools that give an MD degree, They're highly regulated for quality by this licensure committee called LCME. And medical school is very expensive. You know, every fourth student has a donor, a cadaver donor. Every student has to have conference rooms and placements and learning environments. So it's very expensive to scale. And the fastest thing we could do was to expand and get approval for this rotational strategy. So what the students will do is they'll have the pre-medical school 2 weeks, then they'll come for an elective for a month in the first and second year, and then summer's here, and then 3 months in the third year, 3 months in the fourth year, and then have to come back to serve, either as a resident, which is after medical school in family medicine or pediatrics or surgery or medicine, or come back after they've done their residency training somewhere else for that repayment. And we hope then they sink in their roots and stay. And programs like this, the data says 90% of them do stay. So what do we need? One is we do need housing, so that's an issue. And I think the community colleges, Eastern Shore, a lot of people are thinking the hospitals, how can we help with dorms, housing? Because these students will come for 3 months, come for the summer, and we want that to be a great experience for them. So that's one thing. The second thing is we need to create the residencies so that they do stay here. And so we're working with President Kozel on creating a family medicine residency, neurology fellowships, gastroenterology fellowships, which are highly sought after, finding these residencies. Tuttle Health has residencies, and we're excited about creating opportunities for these students. But if you think about it, this is our second class, so in a short 2 years, we're gonna have 10 of the top American students, because it's so competitive to get into med school. Every year, there's gonna be 10 students ready to come here to serve in residencies. And that will be like a spigot turned on that will bring these students here. And so the last thing we do need are these scholarships, because these scholarships are what really attract people and provide them so they don't come out with so much debt so that they need to go to the city and be a neurosurgeon or an orthopedic surgeon. So those are all the things you can do, and so many of you are already doing so much for the program, so we're so appreciative.
Next question. Delegate?
So good afternoon. So I'm Delegate Tom Hutchinson. I am just absolutely thrilled that you are here. I'm so glad I came here. So I serve on the Health and Government Operations Committee in the House of Delegates. So I'm the only representative on the Eastern Shore in the House of Delegates that's focused on healthcare issues. Senator Mounts is on finance, and at the Senate side, he hasn't. We work really well together. You know, when I first was elected, my first issue was the $100 million that was taken away for our new medical center here, and we were focused on making sure that happened. Sorry. But a brand new state-of-the-art medical center without staff doesn't work. So all we have is just a brick and mortar without the people that are there. So as a member of the Health and Government Operations Committee, I have been laser focused on workforce shortage issues, whether it's a bill creating the limited scope x-ray machine operators, getting reciprocity for advanced practice nurses, expanding access to behavioral health services through telehealth. I mean, these are all bills I've either introduced, I've worked on, and are very, very focused on it. It's not so much of a question for you, but it's what I find is that we have roadblocks within our state, whether it's in the Board of Nursing, Board of Physicians, Board of Pharmacy, somewhere along the line, there's something that's holding us up to be able to get that. And I will always look at any of the scope of practice bills diligently, but I'm also going to make sure that our quality of care hasn't been diminished by expanding somebody's scope to do that. So my real question or my ask to you, not right now, is bring those issues forward when you see them, because legislatively, I'd be happy to tackle that and get that done to make sure that we're bringing the best here. And I also want to applaud you for mentioning Tuttle Health, because I do spend a lot of time down there as well. And they have created a great residency program there. millions of dollars invested to make sure that we are getting physicians on the shore. And when you come to the shore, you know what happens. You'll love it here, and you don't leave, and you want to stay here and practice. So thank you. Thank you for doing this today. Great.
Thank you. Thank you so much.
Just one quick comment. First of all, appreciation. Our goal is providers working at the top of their license, access and reimbursement for telehealth. All these things are so important to bring care here. But one thing just to point out is we now have approval to expand the medical school. So that has happened. And so that regulatory framework has passed, and we have already increased class size from 150 to 174. So we now have a wave coming in 2 years that we need homes for these students. Residencies are funded typically through CMS to something called General Medical Education, GME, to the hospitals. And CMS funds residency positions. And as we're increasing the number of medical student graduates across America in response to this unmet need that's going to hit us, we're starting to see shortages of residencies. And the Eastern Shore has a big problem with not enough residencies. Tidal Health is addressing this, but we're really looking at Shore Health to expand family medicine residencies and fellowship positions as well for specialists. And the support for those residencies comes through the rate commission from CMS dollars. So that's another way you could help by pushing residency expansion both at Shore Health and as you're doing at Tidal Health. I think that's something, because then those students, as soon as they're done with their 4 years of med school, they can get that credit for loan repayment by going to the family medicine residency. And the data shows if you do your residency at a place, you're likely to get married, settle down, especially these young people who are coming from the Eastern Shore. So thanks for all your support.
Sure. I just wanted to say thank you so much as well for your support of nurse practitioners. We know that in many rural communities across the United States, there's such a great need for primary care providers that is unmet. And nurse practitioners often fill the spot. I gave the example of Samantha Hoffman at Chop Tank, right? She's a pediatric nurse practitioner that's here, that's able to provide primary care to pediatric patients here on the shore. And we have several other family nurse practitioners working here on the shore. I generally do reach out to Jocelyn Pena-Melnick in the same committee for some of the legislation, but you're absolutely right in that we really have some bottlenecks. How do we get a CNA to an LPN, to an RN, and some of that's really going to take some policy effort to help us make those transitions. So I look forward to working with you on some of these issues in the future. Thank you.
Dr. Jarrell, if you don't mind, I'm going to introduce an online question. We do have quite a few people watching the live stream, so I'm going to give at least one opportunity. One of our viewers is Howard Haft, whom I know many of you know. He writes, primary care physicians, particularly independent physicians, are the anchors for community health and sustainable health care. How does the plan encourage independent primary care?
Yeah, so that's a great question. We are, a big part of this is we've actually created a special rural health primary care curriculum. So in addition to the students learning biochemistry and anatomy and physiology and mechanism disease and all pharmacology and microbiology and all these things they learn, and then rotating through specialties, we also have a curriculum trying to prepare them for primary care practice and private practice. So some of the business of medicine pieces. We're also setting up, as you heard from Dr. Retner, rotations with physicians in private practices. And I think that's going to be the best opportunity to really learn how to make this work. How do you do it? And, in more, urban areas, physicians are all joining networks. Those opportunities aren't necessarily in these rural areas. Plus, I think that's an attraction to being a primary care physician or a specialty physician in a rural areas. You can have your own practice. So I think those two things, mentorship as well as that core curriculum that Dr. Rettner's been setting up would be our effort to address that.
For those of you who don't know, Dr. Haft on the phone has been a great friend of the university, but more important, a great friend of primary care, particularly on the lower shore, and very involved with that. So people like that with a lot of energy to make things happen. We have another question here.
Greetings, and thank you so much for your leadership in organizing this wonderful exchange of information. Thank you so much. My name is Ileana Lindstrom. I'm a psychologist licensed by the state of Maryland, and I couldn't leave here today having heard about this truly wonderful collaborative ecosystem. I am hoping, and here's hence my question, have you already, or do you intend to invite mental health practitioners, psychiatrists, psychologists, licensed clinical social workers, the whole spectrum? There are many of us here, and to the table of the collaborative ecosystem.
One of the things I left out was to thank all of the public health, particularly behavioral health, mental health people who are also signed up here. So yes, we're paying attention to that. Dean Ogbolu?
Sure, yeah, I was just really struck by the behavioral health infrastructure, just being here the past couple of days. And so I know the importance of mental health and the importance of holistic health. There's no way to have a program that promotes health without including mental health, so absolutely. We do have a psychiatric nurse practitioner program at the School of Nursing, and we have just a few that also work here on the shore in the psychiatric mental health space. So we would really love to continue that conversation with you and make sure that you're on the agenda. We're meeting with a lot of partners as, unlike medicine, we're still in the exploratory listening phase, and we're really wanting to make sure we really listen to as many people as possible. So thank you for raising that awareness.
Yeah, and I would just add, we have a very vibrant department of psychiatry. And for example, you know, we have residents that work all across the state in public health departments, Shepherd Pratt. We have a large faculty that serves the communities across Maryland, so we receive a lot of support from the Department of Health for the work that we do in psychiatric care, both inpatient and outpatient, and telemedicine, and also a big focus on trying to tackle one of the great generational challenges we face in substance use disorder, which is, you know, this fentanyl epidemic affects everyone, you know, rich, poor, white, black. It is devastating families, our communities, our friends. And so this is something we're also very committed to address. And so this will be a big push about what we do as partners. The great thing about the University of Maryland at Baltimore is all the schools are represented in health sciences. So we also have a wonderful school of social work, and we partner with them. And so we really look forward to that. You know, the brain is the next frontier for human science and medicine. You know, think about the things that hit the brain, from anxiety to depression to addiction to Parkinson's, Lou Gehrig's disease, autism. You know, it's just, there's an immense opportunity, and we're very focused on neuroscience as well. How do we find those next cures for fentanyl addiction, right? Yeah. So we appreciate that great question.
Yeah, and please keep in mind, I'm a psychologist that have specialized in the assistance of people who are recovering from trauma. Mm-hmm. And trauma, as evidence continues to present itself through research, is undergirding a host, if not all, or not all, but many, most, if probably many and most, of all of the struggles of the human body, medical, physiological, you name it.
Yep.
Look for trauma, please.
Thank you.
And we're here to help.
Thank you.
Thank you.
Next question.
Okay, hi everyone. Thank you so much for being here. I'm Lisa Widmeyer. I'm the Executive Director at the Eastern Shore AHEC, Area Health Education Center. So our mission is pipeline programming, and we are in the schools. We are doing programming. So I appreciate your emphasis on workforce development. We're part of the Rural Maryland MD Scholars Program. So you mentioned a little bit about preceptors. So as I'm anticipating these student numbers growing, I just ask that the audience and UMB leadership recognize the need for additional preceptors, because we have preceptors that have been around for 30 years and they're going to be retiring. And so we need additional preceptors, and I just want to emphasize the housing piece. These students, they cannot afford to rent, to pay hotel fees for a month or 2 months or 3 months, or Airbnbs are even expensive. So we do have 3 units here on the shore, but they're very, very costly, and we need more homes for these students to be housed at. So I appreciate all of the residents of the Eastern Shore that have offered up their homes, their frogs, their above the garage opportunities for students. So we really appreciate that. But I also want to emphasize the need for dental hygienists. Casey Hires is going to talk a little bit. So we implemented a new dental health careers programming in the high schools. It's been wildly successful. And we have so many students that are now interested in dental hygiene, dental assisting at Chesapeake, which we refer to, and then, of course, dentistry. So, Casey wants to talk a little bit about the need for hygienists here on the shore. I was very interested in hearing about, including some satellite campuses for nursing, but we also need a satellite for hygiene. We used to have one, and it closed, and now our shortages are just, it's insane how hard it is to find a hygienist. So, Casey.
And I do want to just say a few words of appreciation about AHEC. They've been incredible partners out of the gate with Rural MD, providing housing for our students, helping us link our students with preceptors. So really appreciate. There's been a long-standing partnership with our Department of Family Medicine with AHEC, so thank you very much.
Thank you, Lisa, for the introduction. Yes, Casey Hires. I work at Eastern Shore Smile Solutions, practice that was founded by Dr. Randall Hires, who is an alumni University of Maryland School of Dentistry. He served his career here for 30 years. But I do want to ask, it was reported in 2024 that there were about 3,500 licensed hygienists in the state of Maryland, and on a recent survey, industry survey, 31% of hygienists intend to retire within the next 6 years. So on that math, the state needs to replace about 1,000 hygienists over the next 6 years. So what plans or what is the University of Maryland, particularly School of Dentistry, planning on doing to increase enrollment, minimize attrition, and help the dental industry to continue to provide and increase access to oral health care on the Eastern Shore? So thank you all for being here as well.
Dean Reynolds, it's your moment.
Thank you for that excellent question. The shortage of dental hygienists is national within the state. There are seven programs within the state of Maryland, not on the Eastern Shore. Part of our vision is a clinic that would allow us to train dental hygienists on the shore, as well as other dental auxiliaries, such as chairside assistants and laboratory technicians. We're working with Dr. Debony Hughes at the Office of Oral Health in the Department of Health, and the futures for the Pathways to Bright Futures program, where we're trying to bring educational programming to youth to inspire them to pursue careers in dental hygiene. So our program, just to make you aware, if you're not, our program is the only baccalaureate awarding program and Masters of Science awarding program in the state of Maryland. So we together with other programs, train the workforce in Maryland, and we recognize the need is growing. The pandemic has impacted not only our dental hygiene workforce, but our dental workforce as we look at the number of practitioners who are now transitioning into retirement. So thank you for the question.
But to give you an idea of how expensive it is, Mark, to put a dental chair into a training facility, what's the cost of that?
The cost is a minimum of $150,000 for a chair. That doesn't include the capital expense. That's just to set the technology in.
So again, it gets expensive. That's not a reason to not do something, but it is a reason to plan it well. That's for sure. Yes.
Given the opportunity. Unlike physicians and nurses, we have to run our own dental hospitals. Many countries have hospitals that are solely for dental services. So it is costly. There's a capital expenditure. There are costs associated with running the facility aside from the delivery of care, which is one of the reasons we look to partner with other organizations to help offset the costs. I think we have an outstanding workforce that's under-deployed. With a little assistance, we could be far more impactful. Thank you.
Next. Jarrell, we have time for just one more question, I'm told.
Okay. Does that mean he can ask us a
He
question?
can ask the question. I just want you to know. This is our last questioner. Go ahead, sir.
Good evening. My name is Jordan Burnett. I'm a family physician with Choptank Community Health, and thank you very much for welcoming us. Sarah Rich says her highs to everybody, and I work with Samantha over there. So Choptank Community Health, if y'all haven't been familiar with us before, so we're the community health center that serves Midshore, and we provide primary care services to about 30,000 patients here on the Midshore. Along with also behavioral health services, medication-assisted treatment for opioid abuse disorder, pediatrics, family medicine, dentistry, we do it all. And we've already been a very proud partner with UMB to host medical students, PA students, DNP students, so we're very excited to continue that as we go on. And when the family medicine residency program does come into fruition and gets funded, and if anybody knows any funders out there too. But we'll be the kind of continuity site where the actual family medicine residents will learn to practice outpatient medicine. So we're excited to be part of that. My question for you, and kind of a comment, so the Rural MD program, what these scholarships do, it really is fantastic. As medical tuition gets more expensive and graduate medical tuition in general, y'all, a little part of the HR 1 bill that people don't realize is that it's actually a maximum to the amount of student loans that students can take out in the future. So it's about $257,000, incorporating all of undergraduate and medical loans, so something like the scholarship it really does open up opportunities back into primary care, especially. Because when I heard that change in the first place, I was like, wow, nobody's going to go into family medicine anymore. So truly, thank you for what you're doing. And knowing about how the loan situation might change in the future, is there opportunity for expansion, like expanding the number of students, or either like in the dental program, which I also know is 4 years, is there opportunities for scholarship in those as well?
Talk about that briefly.
So first of all, thank you for the partnership. We agree completely with you that we're worried that cap on total loans, especially because many students, to get into med school, they have to go to 4 years, and many of them do a gap year to be more competitive. So many of them are doing 5 years and then applying to medical school, and they may have exhausted that loan limit. So we're very concerned about this. So this kind of program with full scholarships, we think will be key to attract people to a career in rural areas. And as you know, this rural healthcare access is true all across the country, not just in Maryland. The last thing I'll just share with you is we are actively working right now on the concept of a 3-year medical school that would automatically go into pediatrics and family medicine, because those are the areas of most need. And so you would go right into our residency for family medicine and pediatrics with 3 years. That would save tuition money, and people would then want to go into those specialties because they can fast track. And we're thinking about, for that program, we would selectively accept people for that 3-year program that had already been a practicing nurse or a practicing advanced practice provider, a CRNA, nurse anesthetist, or physician assistant that said, oh, you know, I would like to go to med school, but I don't want to do all that, you know, biochemistry and genetics. I'm already an experienced physician, provider. And so that's one thing we're looking at right now, which would also address that. But I think this program addresses a lot of your concerns, and it becomes super important. Thank you.
I have to make sure the Dean of Nursing doesn't hit the Dean of Medicine. But a comment, and it's an important comment, about the Choptank Community Health. So Choptank exists as a federally qualified health center, which means it is a federal program. I don't think that it's been cut at this point. Does that sound right? Not yet. Not yet, and hopefully not. But the important thing to stress is you all, like me, would automatically think when you think about medical student and resident training, you think hospital. And you shouldn't think that. You should think outpatient medicine, outpatient nursing. All of those things are extremely important in terms of training the next generation. I want to avoid the hospital. It gets back to the first question that was asked about wellness. And I think that's really an important thing here, that we not lose focus on inpatient, high degree of specialty kind of stuff. And we remember that there's a whole nother world, an important world, that has been neglected in terms of outpatient primary care. And you are one of the main supporters of that, and we need more of that for these programs to succeed. So they're really important. One last thing to mention, the Dean of Medicine mentioned a 3-year medical school curriculum. We've been in serious discussion. The School of Pharmacy has talked about what's called a 3x4. The physician assistant program is talking about 3 years, and then the PA program, which is an additional 2 years. The physical therapy is talking about cutting off an earlier year of training, so that with all these programs, you ought to be able to get people through their education quicker at the same degree of competence. And one of the nice parts about this is if you go to college for 3 years, and then you go to one of these schools, the credits you get in the first year of med school or pharmacy school count towards your bachelor's degree. So you do get your bachelor's degree, and then you get your advanced degree when you finish. So it's a kind of a nice, smooth transition. I was always amazed that you do not need to graduate from college to go to medical school or dental school, okay? You have to have 90 credit hours of the right credits in order to go to medical school. And so it's sort of an interesting thing to take advantage of in terms of streamlining things. So Mary just went like that to me, but Alex, are we really at the end?
Well, yes, I think we really are at the end. We've had some online comments I'll pass along to you after the show, but I think that's it. We're ready to go.
So, first of all, thank you all for being here. I appreciate it. Second of all, I hope you appreciate how beautiful this theater is. It's renovated. I hate to confess to you all, but I came to this movie theater as a kid. I don't remember what I saw, but it was probably The Blob or something like that. But it's a beautiful facility. Third of all, your help in making this happen is critical. We can't do it on our own. The state can't do it on its own. We need teams pulling together, and you can help us do that. With that, we have a reception right outside the doors. Please, I invite you all to stay. It'd be nice to meet as many of you as we can, and look forward to following up on this with more medical students, with nursing students, I hope dental hygienists, Mark. Okay, and maybe some other things. So thank you very much.